Leaders of Indigenous communities are calling on the government for action on opioid-related deaths in First Nations in the province. They say the closure of harm reduction sites along with the pandemic have led to a staggering amount of drug-related deaths.
A new report shows a number of First Nations people who died from opioids in Ontario more than doubled during the first year of the pandemic.
We need to do more. We need to do a lot more. This is not something that came up just last week. This stems right from the six scoops at residential, and everything's piling up and adding up.
Data released by the Chiefs of Ontario and the Ontario Drug Policy Research Network shows 116 First Nations people lost their lives due to opioid poisoning from 2020 to 2021. This was an increase of 132% compared to a 68% rise amongst the rest of the population.
We got to help our own people. Don't just come and let's not knock on their doors every 3-4 years. We need these kids. If we're talking about the future, we got to protect our young ones.
The report shows the mortality rate due to opioid use is approximately 4 times higher than the rest of the population. Off-reserve First Nation individuals and those aged 44 years and younger are even more impacted.
I've been chief for 30 plus years now. I've seen it all because I think there's more to come if we don't do anything, and you don't do nothing now.
The Chiefs of Ontario say the Truth and Reconciliation Commission calls upon the federal government to establish measurable goals, identify gaps in health outcomes, and recognize and implement the healthcare rights of First Nations.